Hello, today we are going to talk about different departments in a hospital and the names of the doctors or staff, hospital staff that are associated with this department. So this is for people who wish to make their English better, and they're working in the healthcare department. Either they are doctors or they're other fulfilling other roles in healthcare, and maybe you are struggling with some of the words in English that are required for healthcare professionals, and you're finding it difficult to communicate with your colleagues or your clients or your patients, and this is affecting your profession or medical practice in some way, and you wish to increase your English fluency or English writing skills or presentation skills. So this video is a basic video for you, and let's take a look at the different departments in a hospital, and we'll also have a look at which professionals are associated with which department. So here is a scheme from Google of a hospital. This is an imaginary scheme, of course. Hospitals may have many other departments and may have different structures. So first, we begin at the bottom, which here is the basement. And often we find that the laundry and the stores are in the basement. So the laundry is where the linen for the patient's beds and the patient's dresses and many other things are regularly cleaned. So if you have been a patient in a hospital, which you probably have been at some point in your life, you would have seen that your bed sheet and your the cover and your dress is regularly changed in the morning and sent off to be washed, and this is where they go, to the laundry, right? And the stores are where everything is stocked. Okay, anything that is required in the hospital, could be medicines, could be equipment, could be bandages, could be other things, could be ration for the kitchen, could be many other things. Anything and everything that is required for a hospital is kept in the stores and pulled out of there as required. So then we come to the kitchen. The kitchen is, of course, where your food is prepared, the food for the patients, according to the prescription of the doctors and the dietitists. This is a very important department in a hospital, because food is so much the part of the treatment, and it requires very professional chefs specializing in healthcare to make the exact food different patients need according to their prescriptions. Okay, now we come to the place where everyone is taken when they have an accident or a sudden serious medical condition like heart attack, etc., and this is called the emergency, or ER. Sometimes it's called ER in short, right? And you find paramedics in the emergency, right? Paramedics are people who are responsible to provide first aid, okay, life support, before the doctors take over. So we have here paramedics, all right? Paramedics, okay? So PARAMEDICS. Sorry, the writing is a bit confusing. So paramedics and doctors and nurses, okay, and similar people, porters who bring in and take out equipment. So sometimes you do find specialists if they are required, but for that the patient is usually shifted to another department or another bed. Now we have the next floor, where we have the reception. This is where the receptionists sit. They fill out the forms for the patients. They admit the patients, or when the patient has recovered and is leaving the hospital, they perform the checkout. You have the blood bank where blood is stored and then given to patients as required by matching their blood groups. You have the pharmacy. The pharmacist works here and they dispense medicines according to prescription. Laboratory is where all the tests are done and whatever tests are required to run by the doctors, these are done here. Blood tests, any other tests. Okay. Dental services is for the dentists who check the health of your teeth and perform and give you medicines or perform any surgery, or probably the surgery would be done in an OT, which is for all surgeries. And then we have a nursery administration. Okay, nursery administration is for very young kids. It could also be called the pediatric word, pediatry. Okay, pediatry. And then we have the hospital administration. These are for the administrative people who are looking after the day-to-day affairs. They are not necessarily doctors, but definitely connected to healthcare. And maybe some of you who are watching this video are administrative staff in hospitals or other institutions related to healthcare. Outpatients department are for patients who have come for treatment or a checkup but are not going to be admitted in the hospital, so they will just visit a doctor. The doctor will screen them and make a prescription. If required, if the doctor feels, they might advise the patient to be admitted to the hospital. So that is the outpatients department. All right. Sonography and ECG. These are tests that are run to find out what's inside your body or what's inside your brain, more specifically, sonography. And ECG is a test which is required. It's called echocardiogram in full. It's required to find out the condition of your heart. Labor ward is where babies are delivered, where babies are born. So this is for highly specialized doctors who are associated with giving birth. Endoscopy department is for ailments inside the digestive system. It could be tumors, it could be simple gastritis, and the endoscopy department has specialized equipments which are used to find out the condition of the interiors of your digestive system. Urology is for treating the kidney-related disorders, right? Or urinary tract-related disorders. Surgical wards is where patients who require surgery or are recovering from surgery kept, and this is often associated with the OT or the operation theater. And this is where all the surgeons are, okay? The surgeons who are performing the surgery on patients. And then we have a recovery room. This could be a recovery room for operation theater, where the patient is kept for some time just after the operation to stabilize before being shifted to their respective wards, respective departments, after the anesthesia has worn off a little bit. The children's ward is where very young kids are kept, and this is the pediatric ward. Okay, this is also called the pediatric ward. We have the orthopedic ward for doctors called orthopedists, who look after bones and muscles and the movement of people, problems with movement, disabilities with movement. They often look after sports people, players who have suffered injuries. ENT, ear, nose, and throat. So this is a department where people having problems with their ear, nose, or throat systems come, and the doctors specializing in these departments are called the ENT doctors. Besides this, you can have many other departments in a hospital, a department specifically for age-related illness, old age-related illness. That would be called a geriatric ward. And elderly people who have specifically age-related problems will go to visit a geriatric ward, and the doctors who specialize in this department are called geriatrics. Okay, so these are in general some of the departments in a hospital, and different specializations and specialists associated with that. We can have later on perhaps a video which has more details about this. This is just a very basic introduction for people in the healthcare department, for all these dedicated professionals who are making life so much better for so many people all around the world. But maybe some of you are not native English speakers, and so you need a better English to be able to communicate with your colleagues in a hospital or in a clinic, your clients, your patients, of course. So this is a basic vocabulary course for you, a basic vocabulary introduction for you. And if you're interested to learn more about the English for healthcare, you can book a 30-minute session with me, and we can. This is an absolutely free session. We can sit down and talk about areas where you need help, and we can chalk out a plan for your improvement, and I will give you some advice accordingly. So see you. Have a good day. And do feel free to contact me either in a message or connect with me on LinkedIn in order to discuss how I can or what sort of advice I can give you to help you better your English. It's absolutely free for 30 minutes. You can just talk to me and find out what you need to do. All right, see you.